Hi everyone, my name is Martha and I'm with Amirah Zaky that I actually found on Instagram, and she very kindly agreed to do this session, and this is the start of our relationship. Really, we are just meeting each other for the first time, and she started to share about her background and her work, and I thought you need to stop and then let's just start recording. So we are doing a discussion on vaginismus. So tell us again what you do and how you got into helping people with vaginismus.
Yeah, great. So it's a slightly long story. I'll try and shorten it as much as I can. So this started back when I was 18. So I got married really young. I was 18 when I got married. And I got married at that age because I met my husband, my now husband. I met him back then. And according to my religion, it's not really right with my religion to kind of do dating and to have sex outside of marriage. But I kind of knew he was the one that I wanted to marry. And so even though I was very young at 18, I knew that I wanted to marry him to do things according to my religion and not do anything sinful. So we got married, and um, after a year, we then moved out. So we got married at 18, and then at age 19, we moved out and we lived together. And when we moved out and lived together, that was essentially going to be like my wedding night, the time that I have sex with him for the first time. But I remember in the lead up to my wedding night, when I was going to kind of lose my virginity and have sex for the first time, I remember feeling very anxious and very fearful about having sex for the first time. And that fear and anxiety came from all the stories I'd heard growing up, whether it be from, the media, whether it be from friends, and they tended to be very negative stories, things like sex is really painful the first time, or just negative messages about sex and the body. So I was very afraid to have sex for the first time, and we still tried to do it, but when we tried, because of my fear, it was such a struggle, and it was really, really painful that his penis wasn't able to penetrate my vagina, and I didn't really understand what was going on. And we kept on doing that, over the course of about a year. We kept on trying to have intercourse, and it just wasn't happening. It was pretty much impossible, and every single time it was just getting more and more painful. And the more and more times that happened, the more it affected me emotionally. Like I said, I had no clue what was going on. I didn't know it was called vaginismus back then. And kind of after living like that for over a year, not being able to consummate the marriage, not being able to have sex, it placed such a huge burden on me emotionally, but also on our relationship and the marriage. So it kind of almost reached breaking point, and I didn't know what to do. So I turned to the internet. I went online, and I think I searched for solutions to painful sex, which I did. And eventually I landed on the term vaginismus. And when I read about vaginismus, it was literally like that light bulb moment. I was like, yes, that's exactly what I have. So when I discovered that I had vaginismus, so I self-diagnosed. In general, it might be recommended to go and get a diagnosis from a doctor, simply because you want to check that there's no other physical abnormalities. But back then, I diagnosed myself. I think I was too embarrassed to see the doctor, but I'm glad that I diagnosed myself, simply because it gave me it empowered me to then go and treat myself. So I searched how to treat vaginismus, and it talked about using tools known as dilators, vaginal dilators. So I bought these tools dilators, and it came with a book, and I followed the steps on how to use the dilators myself. And after using the dilators myself, it gave me confidence to then transition to intercourse, and I was able to successfully have intercourse. So through overcoming my own vaginismus, it really just changed my whole perspective about sex, because when I was finally able to have full intercourse with my husband, I was like, really? It's not painful at all. There is no pain. Why did everyone keep telling me it's painful? So I now developed a new belief. The new belief is first time sex is not meant to be painful. And if it is painful, there's something wrong going on. Either the woman doesn't know what she's doing, or the man doesn't know what he's doing, or both, right? So I now truly believe that vaginismus is preventable. I truly believe that vaginismus is 100% curable. And I truly believe that first time sexual intercourse is not meant to be painful. And so this happened, so back in 2009 is when I was experiencing this. And after that, I was kind of continuing about my regular life. I studied biomedical science at university. I then spent 5 years teaching science in a secondary school, in high school. And then I had my kids within that time. And through having my kids, I decided I didn't really want to be a teacher anymore. I wanted to start my own business. So I left my teaching job and I started my own business. And when I started my business, it was nothing to do with vaginismus. It was more general life coaching, health coaching, wellness coaching, that kind of thing. And I kind of started a YouTube channel at a similar time to starting my business. And on my YouTube channel, I put a video on there, and the video was about me describing my personal struggle with vaginismus. And the reason I created that video wasn't actually because of my business. It was simply because I wanted my followers and my customers to know a little bit about me. I felt like I had this secret that it was just me and my husband that knew that I had vaginismus and no one else knew. And I felt like something intuitively was telling me, you need to tell women about this. So I did. I put the video on and I didn't expect it to have the amount of views that it now has. I think it's got like over 40,000 views or maybe more. And so many women from watching that one video, they've messaged me, they've emailed me, they've told me things like, Amira, I'm going through this, please can you help me? And from getting all those messages and emails, I saw that there was such a huge demand for women who need help to overcome vaginismus. So I decided to shift the direction of my business and really go full in on helping women with this, because vaginismus really is a lot more common than we think, and women who have vaginismus really do need our help. So the work that you do, Dr. Martha, the work that I do, and there's a few other vaginismus coaches out there that I know of, it is so, so important, because lots of women are struggling with this, and it's a condition that you don't need to struggle with for years and years. It is possible to overcome it within a few weeks or a few months when you have the right help and the right support. And it is such an amazing job to do. Like, it's so rewarding and so fulfilling to empower women about their bodies, to empower women within their sex lives. So I'm really grateful that I get to do this work.
That's awesome. Thank you so much for sharing. And just now you were asking about my background. So I am a relationship counselor and clinical sexologist. I have a doctorate in human sexuality, master's in counseling. I have certificates in counseling, coaching, sex therapy, and also training in tantra and sexological body work. So in my work, there's no hands-on. And when I first came across vaginismus as part of my training, I was like, oh my God, like I can't even imagine women or people with vaginas having this issue, and wanting to be able to have sex, and the pressure that they have, including the fear of not being able to conceive. And so lo and behold, I started my practice, and for the last 12 years, that is one of the main reasons why people come and see me. Vaginismus or unconsummated marriage, meaning like they are virgins, and they are having difficulties in having penetrative sex. So they may not necessarily have vaginismus, they're just having difficulties with first time sex. And it could be because their partner is also a virgin. So I also work with people with penises who have premature ejaculation, erectile difficulties, delayed ejaculation. So I work with men and women, individuals, couples, work with um, um, all kinds of sexuality issues, including relationship and communication. And the one that I specialize in is vaginismus. So I was very excited when I came across your videos, because I actually also included them as part of the resources for my vaginismus playlist on YouTube for my students. So last year I created a professional certificate in working with vaginismus for other practitioners all around the world, because I've been doing this for a really long time, and I knew the things that I thought were only taught by me. Nobody else in the world had this. And for all the research that I have done with periodicals, with popular media like YouTube, there was nobody talking about the treatment of vaginismus the way I was. And so yeah, in the last 12 years, had so much work with people with vaginismus, and also have done so many YouTube videos, and I have a like an online program on overcoming vaginismus, which I think you also have that.
Yeah, I also have an online course, yeah, to help women overcoming vaginismus, absolutely.
Yes. And yeah, it's really about how do we eradicate this issue?
Yeah,
Because I really um, don't like how they are suffering, you know, in silence.
I'm the same. I don't like it at all.
Okay, so
And
in the
that's
night,
the worst part. It's the worst part that they're suffering in silence, that some women feel like they can't talk about it. They're either too embarrassed, or because, you know, in some communities or cultures, talking about sex is still taboo. So yeah, I agree with you. They don't need to be suffering in silence, and they don't need to be suffering at all, because I truly believe that vaginismus is 100% curable, not
yeah,
99%. I
yeah,
believe it's 100% curable.
yeah, me too. So the thing is it's not that it's difficult to resolve. What happens if many years has passed since
Mm,
having had that issue, the belief that it is very difficult because it has
yeah,
been there for a really long time.
exactly. Yeah.
And by having the right support and the right resources is actually really easy. And because I don't do hands-on work, I just do talk therapy. And
Hmm.
so there are cases, I really have to put the disclaimer out there, there are cases where they really need to be diagnosed through having a physical um, uh, diagnosis.
Mm,
So a gynae may not even be the best person, because a gynae who doesn't specialize in vaginismus may actually traumatize the patient.
exactly. Yeah.
They may just say, okay, just lie down and or spread your legs, and then they'll just try to penetrate
Mm,
digitally with their fingers, of course wearing
yeah.
glove, or with a Q-tip or with a speculum. And
Exactly. Yeah.
it can really traumatize them, especially if
Mm,
they were just going there trying to ask questions,
mm,
and suddenly there's this bright lights and the stirrups,
mm.
and it's just really scary.
I agree.
Have you
Yeah.
heard such
It can,
stories?
yeah, yeah, I have. I've heard stories exactly like that, and sometimes even worse stories. Yeah, sometimes, like you said, sometimes going to the gynecologist can make it worse. That a woman is going to a gynecologist to find a solution and to resolve her vaginismus, but it makes it worse. And that's just terrible. But I've had situations where some doctors just say things like, "Oh, you just need to relax or drink alcohol," and like really silly things that are not addressing the root cause of vaginismus.
And also lidocaine. I put the numbing gel, put the
Yeah,
numbing gel,
exactly.
that's it. And
No, exactly,
it's not about that. It's not about that. I
exactly.
think the lack of sex education really causes a lot of um, suffering for people, especially when we keep hearing things like first time sex is painful, like what you said, and we start to
Mm,
believe that it's painful, and so we are anticipating the pain already. And then when
exactly.
then there's difficulty with penetration, and then that reinforces the belief, and then it makes it more and more impossible for penetration. So a
Yeah.
lot of people are still asking that is a physical pain. That is a
Mm,
physical pain. However, it starts from the psychological belief and also the fear of the
exactly.
penetration. And
100%.
the fear of the penetration is also not just about the penis, it's also about objects as well. So I know
Exactly.
of
Yeah.
people with vaginismus who are able to insert a Q-tip or a finger, but they are not able to insert with a penis.
Hmm.
So I think it's just like it's all vaginismus, you know, as long
It's
as
true.
you have a
And actually, it can
psychological
happen the other
fear.
way around as well. You're right. Some women can insert a tampon or they can insert a finger and then they can't insert a penis. But also, I've heard stories of the other way around where they're able to have sexual intercourse, but they are afraid of getting a cervical smear test, you know, the speculum being inserted, or they can't insert tampons. So it's just vaginismus isn't, as you said, it's not just about the penis. It's where you have difficulty inserting any object.
Yeah, and those of my clients who have vaginismus who are able to have penetration with a penis usually are describing extreme pain. And that's because the muscles is completely tense. I use the analogy of the mouth. When I was a kid, my mom would force feed me, and I would play with her, and I would tighten my mouth so that she can't feed me. And this is exactly the same. So that's
Mm.
what's happening. We are tensing up our pelvic floor muscles, making penetration difficult or impossible, and it can feel like a wall. But that's not because there's something wrong, the hole is too small or anything like that. It's because
Exactly.
you're not mentally prepared and you don't know
Mm.
what to expect. I sometimes call it the fear of the unknown.
Yeah, no, that's a big thing. It's a big thing with women who have vaginismus. It is, they don't know what to expect. And I think the big key is that many women have a lack of sex education. They have a lack of knowledge about their female bodies. It's like, I didn't even know that the pelvic floor muscles existed when I was going through my vaginismus. I only learned about them through trying to overcome it. And that was the biggest key, like knowing that these muscles that I had control over, these muscles can allow me to have pain-free sex. That gave me so much freedom and confidence, knowing that these are muscles just like any other muscles in my body. Like I'm tensing the muscles in my hand now and in my arms now. I can do the same thing with my pelvic floor muscles. And that was the key to knowing that my vagina can be nice and wide and open and anything can penetrate it as long as those pelvic floor muscles are under my control.
It's a muscle, it's a muscle. So
Yeah,
we can tense our muscles, we can flex our muscles, and we
yeah,
get to control our muscles. And the mind actually controls the body. However, we don't know this because we are not encouraged as women to touch ourselves. We are afraid of hurting ourselves, cutting ourselves, and we don't touch ourselves. And so it really is so scary because another thing I say is our eyes are up here, and so we cannot see as well. So we can
mm,
be really, really scared of it. So in my work working with people with vaginismus, when I first started my practice, I true enough had my first client with vaginismus because I work with people with all kinds of sexuality difficulties, and I started to teach the things that I learned in sex therapy and in my training. And very quickly, I realized that um, it was just a small part of what I consider effective. So I started to incorporate my first time sex experience, the things
mm,
that I went through when I learned how to have sex for the first time. And I had a wonderful, wonderful first time sex experience with my partner. We actually practiced using fingers, and we had a lot of communication. And so over time, I started to share like pieces of what I learned when I did the exercises, practices with my partner. And I realized that it was transferable. It was transferable. The same
yeah.
things that I learned in communication with my partner, in doing a check-in at the start of a session, in doing a little what I call debrief, and in doing like progressive steps and working with the arousal, like all these things that I experienced with my partner, I started to teach. And
Mm,
over time, I started to want to make it clearer and clearer with my clients. So I started to draw it out. I started to use charts. I started to develop my own flow chart. And then it became much, much easier for people to understand what I was trying to say very quickly. And
mm,
so I have had many, many clients able to overcome vaginismus uh, in one session, in two sessions, and people who have even gone to the hospital, even the sexual health clinic in our local hospital here, not actually having any success, and yet they
mm,
were able to overcome that issue in one or two sessions. It's a
mm,
lot of it is really having individualized and customized support so
yeah,
that they they get the answers to their questions
yeah,
when they ask the question.
yeah.
It's not enough to just give them like everything, and then like although with an online program, it's not as interactive as coaching. So I still think private sessions really help a lot.
Absolutely, yeah.
um, yeah, it's just we don't hear about these things with the relationship that we need to have with our body. And
Mm,
suddenly we're just from not touching and kind of like being disconnected to suddenly you have the wings now run, and it's difficult.
Yeah, it is difficult. It's the same, yeah. So I agree with you. It's like expecting a virgin who's never looked at herself down there, doesn't know her body, has never touched anyone, to go from being a virgin to then like being a pro at sex. It's just not possible. You need to kind of lay the steps out and lay the foundation and do, like you said, you were able to have a great first time sex experience. And I really believe that women, you know, every community and culture and religion is a bit different in terms of how they approach sex, but really, regardless of religion, regardless of faith, I believe that every woman can have a really positive, wonderful experience of first time sex if she has the right knowledge, the mental training, the physical training, if she's in tune with her body and knows what to do. She needs to be in the know. You can't go from ignorance to being good at sex. It's just not possible. You need to have the knowledge.
There's this whole thing where we want to keep the women pure and innocent and
Mm.
protected and sheltered. And then suddenly when they're married, they're supposed to know everything, like exactly what you said. And a lot
Mm.
of the burden is actually on the person who they're supposed to have sex with. And what happens is they themselves also don't know and don't have the answers. So when
Right.
they don't know the answers and they don't know what to do, they get exasperated and frustrated. And then it can kind of escalate sometimes, and it goes into blaming, like, oh,
Oh, I was
you
just
are
going to
like
say
this,
that,
and the
and that really
shaming.
riles me up. It makes me so angry because typically in some cultures, oh God, yeah, I want to have like a whole rant about it. In some cultures, the men especially start to blame the women, like, why don't you know this? When really it's the men, especially in patriarchal countries or patriarchal systems, where the men are saying, no, sex is hush hush, women shouldn't talk about sex, women shouldn't have pleasure from sex, yet they expect their women or their wives to know what they're doing, expect their women or their wives to be able to have sex the first time, when those very men are the ones that are saying to the women, no, don't educate yourself about sex. And yeah, it's just so
And,
frustrating.
and so when I work with clients with vaginismus, I always want both of them to come in together
Yeah.
with a partner, whether it's a boyfriend or the husband, or whether it's their lover. I don't really care. I just want to support them and meet them where they're at. And even for people in lesbians or relationships, you know, they deserve to be able to enjoy their bodies in the way that they want. And so it's so important that their partner also gets the same knowledge, because when they start to understand what it is, then there's a lot of patience as well that comes with it. Then having understand what it is, then what to do about it, and the steps in which that they can support their partner is also very important. So I end up doing a lot of kind of like sometimes mediation and communication training, because fear is fear. How do you break it
Mm.
down into a way that it then makes it really safe to try?
Yeah, no, definitely 100%. Yeah, I think addressing the root cause of vaginismus, which pretty much can be summed up as fear, when you address the fear, then the woman can easily overcome the vaginismus. So for me personally, my fear came from, as you mentioned earlier, it's the fear of unknown, not knowing what to expect, but also the fear of pain. And when you get rid of the fear of unknown, the fear of pain, and a woman can see for herself that it's completely possible to insert something into your own vagina and there is no pain, that slowly eradicates the fear of pain, because you realize I'm in control here. And when you get used to inserting something into your own vagina, that also gets rid of the fear of unknown, because the more you insert something into your own vagina, the more known and
Yes.
familiar it becomes.
Yes, and I want to say, even though there are dilators and sex toys, and we can use our fingers and different kinds of objects like a Q-tip, you can put a condom over the Q-tip. The thing is that it is very scary to insert into yourself, because we are taught that, oh, you need to keep your hymen intact. The pain
Mm.
comes from the hymen,
Oh
and
yeah.
it's not just the hymen. The
Yeah.
muscle is what is tense. And so yeah, so for me there's no judgment whatsoever. Whatever it is that sexual orientation, marital status that they come in, whatever object that they prefer to use. If they don't want to use dilators, I don't force people to buy dilators. It's not the dilator that cures vaginismus. It's also the
Mm.
way that you use the dilators that It's supposed to facilitate. So if you
Mm-hmm.
have like a lawnmower or washing machine and you don't know how to use it, then it's not really going to be very effective. So a
Yeah.
lot of people are just given these dilators, and what I find a lot of people are doing is that they are actually just scared, and then they just get it over and done with, and so they are
Mm-hmm.
actually really rough with themselves.
Mm.
And so there's this whole piece around pleasure and self-touch and orgasm that also needs to come together with the treatment of overcoming vaginismus.
Yeah, definitely. No, I agree with you. Yes, same thing here in the UK, and I'm sure in many countries around the world where some gynecologists or doctors are saying take these dilators, prescribing the dilators, but not teaching them the manual, how to actually use the dilators. And the manual isn't just a series of physical steps, there's a lot of mental work as well. So it's really important to combine the two, addressing the fear on the mental side, emotional side, but also addressing the physical side, teaching women about their bodies. It isn't just going to be a quick fix. It is possible to overcome it in 1 or 2 sessions, if in those 1 or 2 sessions you get to the root cause and you really empower a woman with all the knowledge, and just like you said, really answer her questions, because her questions are going to tell us where her fear is coming from, and then we can literally get direct to the root cause for that specific woman. And it's different from woman to woman and from couple to couple.
Yeah, and I really wish, like, beyond just supporting my clients to overcome vaginismus, which I have done many times, is what's beyond vaginismus. Like, I wish, I had more time with them and we can cover a lot more about pleasure and
Yeah,
confidence and communication,
yeah.
and really support them to have all the questions around their sexuality answered. A lot of them,
Mm-hmm.
they're like, okay, that's done, and then they just, like, move on and have again functional sex. I would
Mm.
love for them to have empowered sex, to have
I agree.
pleasure-filled
I'm the same. Yeah.
communication, and to really move beyond just, oh yeah, now I can have sex and that's it. Okay, now ready to have baby, and that's not what I would love
No,
for
that's,
women
yeah,
all
that's
around
not
the
what
world
sex
to
is
have.
for. So yeah, sex serves 2 purposes, and one of the purposes is more important than the other, I think. It's for procreation, yes, but it's for pleasure. And the pleasure is meant to last your whole lifetime with that person, with your partner, with your husband, whoever you're with. It's meant to last that whole time, whereas procreation is like small little points in time, like just happens a few times, in that period that you're married to the person or whatever. But after that, it's what's sex for? It's meant to be for pleasure, it's meant to be for intimacy, it's meant to be for enjoyment, 100%.
Yeah, so the fear and just overcoming vaginismus for the sake of it, for the sake of having baby, I feel it's less about just overcoming vaginismus and more about having a relationship with your sexuality, and really coming into your body, and really seeing as it's a journey that you're on, and that this is something precious that you have with you, and for the rest of your life, and you want to, like you said, you want to enjoy it and to be confident about it. And so I think we are
Yeah.
we are both singing the same song.
Yeah, I agree with you, definitely. Yeah, we're completely on the same page. And I think that what's so good about vaginismus, because some women, they come to me and they say, I hate living with vaginismus. Why did God give this to me, or why did I have to have this? And I say to them, it's such a beautiful thing to have vaginismus, because in having vaginismus, you learn so much about yourself that you probably wouldn't have learned if you excuse me, if a woman's able to have sex really easily, that's great, but she maybe wouldn't have learned everything you're learning now, like really paying attention to your body, looking at yourself down there, knowing the way that God created your body, educating yourself about pelvic floor muscles, and knowing how to have pain-free sex is the first step to then learning how to have pleasurable sex. And it is, just like you said, it is such a journey, knowing that vaginismus, again, is 100% curable. It's not like you're being tested with a condition like, I don't know, cancer, where with cancer there's always that element of, the unknown, you might not overcome it, whereas with vaginismus, it's fully in your control. Cancer is not completely in your control, there's other elements at play, but vaginismus, if you have the right help and support, it's 100% curable. And it's such a beautiful journey. When you overcome something difficult and challenging, you appreciate it more, you appreciate sex more.
Yeah, it's really such a shame that people are going to doctors and physios and even sexologists. They don't specialize in vaginismus, and they're just like becoming like guinea pigs. And so it's so important to really look at the credentials of the person who they're working with, so that they get the very specialized, customized, direct approach to overcoming this as quickly as possible, but yet at the same time also completely heal their relationship with their sexuality, and so go deeper rather than, you know, just quickly move on. And I just really want for everybody to be able to get the support that they need. And some of the stories that I hear around vaginismus is just so heartbreaking.
Yeah, yeah, definitely. No, I completely agree with you. I think it's great work that we're doing. I know that it's common in so many countries. It's not just in certain countries. I'm pretty sure every single country in the world has been touched by women who have vaginismus. So yeah, the more of us that do this kind of work, the better.
Yeah, I agree. So it's
Yeah.
been such a pleasure speaking with you. I'm not sure if we left out anything in this discussion. I really hope that people who are watching this, who do have vaginismus, you get the right support for yourself and ask the right questions.
Yeah.
So some of the questions I would ask is if they have worked with clients who have vaginismus, what is their training specifically with vaginismus, if they have any testimonials, and um, yeah. What do you think?
Yeah.
What are some
Yeah,
of the
no,
questions people should be
yeah.
asking their
Yeah, so if
practitioner?
if someone has vaginismus, those are great questions, you know, asking the professional what experience they have, what knowledge they have, you know, maybe asking them what their success rate is, or asking them for the testimonials, like either written testimonials, video testimonials, audio testimonials, but also asking like what is their method? How do they actually help someone overcome vaginismus? Is it purely like a surface level treatment of telling them just use dilators, or do they really do a more holistic approach? I recommend professionals who take a more holistic approach, working with the mental and emotional side as well as the physical side.
Thank you. Yeah, beautifully said. Um, yeah, I think this has been a good discussion. Do
Yeah.
you feel like we need to cover anything else?
No, I think it's been good. I think it's been great as an introduction to the work I do. I mean, I'm sure if this is on your YouTube channel, your subscribers know about you. So it would be great for them to get to know me. And, you know, I think, and vice versa, you know, people who are followers of what I do, getting to know the work you do, because we can't, like, you know, I can't help all the women with vaginismus. I can't help everyone because there's so many of them. So, you know, it's like sharing the load with as many professionals in vaginismus as possible. And equally so, if someone's watching this and doesn't have vaginismus, but has experience in coaching, counseling, get yourself educated about vaginismus more, because there are so many women who need help with this.
Yeah, definitely. Um, I have this like dream that we can eradicate vaginismus together.
Yeah. I think I have the same dream. It's definitely my mission to spread awareness about vaginismus. I think that is the key first step, because when a woman has it and doesn't know what it's called, she thinks she's the only one in the world. As soon as she realizes, oh, there's a name for it, she feels less alone, because she's like, because she tends to think, okay, if there's the name vaginismus, this name exists and it's a medical condition, it's a known condition, that must mean I'm not the only one. And so all of a sudden she starts to feel like I'm not alone, and now I can go and get help for it. So the more men and women who know about vaginismus and know that it's real and it exists, the better. That's the first step. Once a person has awareness that they have it, they then need to go and seek the right, proper professional help to overcome it. And it's completely possible
Yeah.
to eradicate vaginismus, but it really needs to start from when a child is a child, from when a teenager is a teenager, like really educating about sex in age appropriate ways, and for parents and communities and cultures, not to shy away from talking about sex. Sex is not meant to be taboo. You know, there can be modesty, there can be respect talking about sex. It doesn't need to be, you know, vulgar talk. It can be very respectful to talk about sex in terms of the way the body is created, in terms of the mechanics of sex, in terms of pleasure. And I think people need to slowly eradicate the toxic beliefs about sex and the female body especially. And I think it needs to start as young as possible in age appropriate ways, meaning educating children about their own bodies, you know, especially in terms of danger and safety, the internet and that kind of thing. But then as they become a teenager, they will have naturally, they will naturally have questions about sex and their body, really feeling comfortable to educate your own teenage children about sex and the female body. Then beyond, like if in certain cultures and communities, if they expect their women to save themselves from marriage, it's not talking to them about it in a negative way. It's educating them about, okay, even though you're saving yourself for marriage, this is what you need to know to make sure that when you do try and have sex for the first time, you are empowered and you know it's going to be comfortable and that there doesn't need to be any pain. Slowly, that is the way that we're going to eradicate it, to really build up confidence, especially in women, and empower them in terms of their body and in terms of sex.
Yeah, definitely agree with you. So it's a lot, you know. So not just all the burden on the person with the vagina, also their partner as well. The shaming that can happen when their partner doesn't know what's happening, and the anger and frustration
Right.
that makes it even more difficult to overcome this issue. I feel um, it it really needs to start from each and every one of us. And
Yeah.
I think having this conversation, putting this video out there is one of the steps.
Yeah, no, definitely. It's been such a pleasure talking to you. And I really hope whoever's watching this, you know, that you find the help and support if you're going through vaginismus yourself.
Thank you everyone for watching this, and thank you for being here.
Thank you so much, Martha.